People of all ages struggle with maintaining their mental health, including children and teens. Which is why this week's DMV doer is doing her part at her young age. Meet Anisha Maripu. Anisha Maripu was 9 years old when she had an unexpected experience that touched her. She saw a schoolmate in the bathroom that seemed to be in distress.
It was just me and her in the bathroom. There was nobody else there. And I went and spoke with her about why she was crying. And she told me that she was misdiagnosed with a mental health disorder and she was prescribed a wrong treatment, which then caused her some severe side effects. That was just a turning point for me.
Now 11 years old, the sixth grader from Northern Virginia is making a difference. Anisha runs a nonprofit known as the Bhavna Foundation, which gives teens the tools to deal with tough times.
Starting a nonprofit would be the perfect opportunity for me to be able to spread awareness and give talks internationally to educate people about this problem of children not being able to speak up about their feelings because they're too scared to.
She has also hosted more than 100 workshops and countless discussions in person and online.
I'm trying to focus on around like preteen and teenage years because that's the most suicide rate. And I also have my organization also focuses on suicide and provides resources directly.
She goes to different schools in the DMV, around the country, and all over the world, talking to kids about their mental health journey and generating much-needed conversations, including the problems preteens face.
That's the age group that I think isn't being talked about as much. I do know that there are a lot of conferences and discussions happening about teenagers around like the age from 13 and above, but I don't think people really realize the problem that ages 5 to around 12 go through, because that's just an age group that is so special because people usually think that they don't have any problems.
Anisha says the feedback she received after speaking with children in India was rewarding.
They started telling me how it felt nice to go a little bit outside their comfort zone to speak about their feelings and to tell me and to just say what problems they have and what's really bothering them.
She already knows that she wants to major in biology, even though college is still several years away. Meantime, her focus remains the same, advocating for children with mental health needs.
I want to expand it to impact more people around the world. I also want to provide end-to-end mental health care access along with caregiver access